they have been, like I said, hit across and have taken a serious hit as the strike by specialty hospital has now entered its 5th day. The Andhra Pradesh Specialty Hospitals Association, or ASHA as they call, has called the strike over pending dues of 2,700 crores. Hospitals say they cannot possibly keep continuing operations without these payments unless they are paid, because it is affecting their work, their elective and emergency procedures as well. Data shows that pre-authorizations for medical procedures fell sharply by 48% after the strike began. From 34,676 between 6th October and 9th, it's down to 18,040 between 10th of October and 13th. They're saying that, around 10,000 procedures have been postponed. Let me now go across to somebody who is in the middle of this entire strike, and we will talk honestly about what is it that they want. Let me now go across to Dr. C. Avinash, General Secretary for ASHA. Dr. Avinash, a very, very warm welcome to you, sir. I mean, the way, talk a little bit about how the healthcare has been crippled, doctor, because I've been hearing, look at those pictures, ladies and gentlemen, this is a very important story. Healthcare, primary healthcare, and both emergency and OPD services, that they are crippled. Where do the poor people go? So how bad is it, doctor, right now?
So let me tell you a little bit about the state-sponsored health scheme here. Currently it is called NTR Vaidya Seva scheme. Previously it was called Arogyashri scheme. This scheme has been running since almost 20 years. And initially it was by an insurance model, then it is now currently run by a trust model. Now our Honorable CM has proposed that he's going to go over for a universal health scheme, which covers basically 100% of the population of Andhra Pradesh. So at this point in time, the Arogyashri scheme or the NTR Vaidya Seva scheme covers about 93% of the population. So this is provided both in government hospitals as well as in private network hospitals. The private network hospitals, people depend on the private network hospitals mainly for high-end surgeries and high-end things like oncology, cardiology, neurosurgery, chemotherapy, dialysis, and those kinds of polytrauma and things like that. Now, over the last few years, the dues have been pending up. So now the dues have come to an unsustainable level. Basically, every month there are bills about 250 to 300 crores. So on an average, 10 crores of service is being provided every single day.
Right. Dr. Avinash, I'm cutting you. Sorry, apologies. Arogyashri was started by Rajasekhar Reddy, if I recall it right. Please correct me if I'm wrong.
Yes, that's right. That's right. And way back in 2007.
That's right. And then, at that time, it was one of the most successful schemes. And, a lot of states wanted to actually copy-paste that because it really worked like clockwork. But now, like you say, there are challenges. Now, these dues have been pending, not just under this TDP, NDA government, but also it's been there since the YSRCP government was there. So so it's his son, Jagan Reddy's, I'm not blaming him, but I'm talking facts now. Dr. Avinash, I want to ask you something. When you say dues are pending, which means everything in the hospital must be impacted. I'm not going to talk about your salaries, doctors. You are people who sacrifice. But I'm talking about medication. I'm not talking about oncology medication, but any medication which is required for patients of any disease, pediatrics and, neurology or even gynecology, those medicines must be pending. Also the staff payments, the ward boy, the nurses and the other staff, the petrol in the ambulances. It's a major challenge. How do they go? How has it impacted you? When you say it's pending, please list 3 main things that are really creating a big problem for you. Dr. Avinash.
The most important things that obviously patients come to is basically drugs and implants.
Right.
So for doing any cardiac surgeries or any fracture cases and things like that, we need to buy implants. No vendor gives dues for over 30 to 60 days. That's the maximum credit they extend. So we're all part of the MSME sector. So most of us depend a lot on the cash flow. So when cash flow is not there, automatically the vendors refuse to give the drugs and the implants. And also basically, they, obviously discounting policy also disappears when you don't pay bills on time. So at this point in time, when we are not getting the bills which have been pending for around
Right.
12 to 15 months, we have had to go to the banks and ask for an extension of our ODs and everything.